This session will be recorded, so if you actually want to have it replayed to refresh at any stage, we will be sending you a copy of this. So I just want to introduce the team. So basically we have Jade, Kelvin, Monique and Dylan and myself, who are all pharmacists and clinical tutors. And then we have Rebecca and Bethany, who are our ITP administrators. So basically they look after a lot of the enrolments and the administrative tasks. So the intern year, basically this is the snapshot of what the intern year should look like for your interns. So the parts in the yellow there are basically what is required by the pharmacy board. So they've already got provisional registration. They'll need to practice the 1824 supervised practice hours and have an approved preceptor and practice site as well. And then in the blue, we basically have, so then we also need to actually see that they sit the written and the oral exams, which is basically towards the end of the intern year. For most of the mid-year interns, that will be in February. So most of them will probably be looking at sitting in February 2024. And then we've got our intern training program. So I will just remind you that the Pharmacy Board of Australia at the moment, we are still operating under the COVID addendum. So we get this question quite a lot through our inquiries. So we are operating still under the 1575 hours, and the interns need to complete 75% of the 1575 hours before they can register for the written and the oral exam. So just so you know, AHPRA and the Australian Pharmacy Council, APC, they do actually check this and they are quite strict about it. I don't know how they monitor that, but they do go through a rigorous process to ensure that they meet the requirements. And the other thing is they don't need to have met the 75% when they enroll to be sitting the exam. It just needs to be by the time their exam comes up, okay? So the intern year itself is quite cumbersome, and it takes a lot of scheduling and planning in advance to make sure that they do actually complete, obviously within due time and within the recommended time as well. But having said that, our intern program is very flexible, and we do allow for people that have families and obviously opt to perhaps just do their internship part-time. But as you can see, there are quite a few different components. So the portfolio is probably the most chunky and clunky of all the components. And a lot of the time, I think in order to get through it successfully, it's basically just breaking it down and actually allocating it throughout the weeks that are ahead, months that are ahead. The interns are also required to attend two-day workshops throughout the year. These are actually allocated to them. For the mid-year interns, it's usually online because we only have a small cohort, and often they are from all over Australia, and at least then we can accommodate for everybody. The compulsory attendance, we do actually record this, and so we do monitor it. So if they miss one of the workshop days, they're more than welcome to register for another one. But we, towards the end of the period, there aren't that many workshops that are offered, so they may be a little bit delayed in completing their internship. So if they haven't already organised with you to actually attend a workshop, or they haven't put in, to actually have some days off, then please prompt them. The other thing is we often get preceptors ask whether this is paid as annual leave or whether it's paid as, I guess, like just for them to attend. And often it's just a negotiated thing between the intern and the preceptor themselves. We usually suggest just doing it within good faith, but obviously it's just for you to negotiate with your intern. So then they've got 2 assignments as well, and these are usually self-paced. They consist of multiple choice and both short answer questions, assessing practical knowledge and allowing them to be able to apply their knowledge into practice. So a lot of the time the interns don't realise, but the questions are actually guided around the written and the oral exams, and we sort of heavily focus on the national competencies and make sure that they meet all the requirements of the competencies. So the submission of the coursework itself. We sort of split it up over week 9, week 18, and the final submission. The week 9 submission will be coming up very soon, so probably within the first next 5 to 6 weeks, depending on when your intern started. The reason that we don't actually have a deadline and a due date per se is that the interns start at all different times, and even though we might have a due date on the portal, a lot of them panic about that, but we're pretty flexible about it, so long as you complete within week 9, week 18, from when you actually commenced the ITP. The final ITP submission is usually the last thing that they submit, and basically throughout the year, if they're actually submitting everything on time, it becomes very less overwhelming overall. So you would have received basically the Preceptor manual via email, and if you have not received that, please make sure that you reach out to us so that we can email it to you. We don't expect you to read all of the details, so basically what I sort of suggest to the preceptors is maybe just refer to it when you actually have any questions. Everything that you need to know about your intern's intern year will be within the manual, and for anything that you need clarifying, please reach out to the team. These manuals are also available on the intern's ITP portal, which is housed under Guild Ed, and it's under the important resources and monthly guide. So all of the policies and procedures can be found there. The other thing they normally ask us for is an extension form, and these can also be found under manuals and policies. We only require an extension form for anything that is submitted after 3 months. So basically, there's no need to panic if they're going to submit the week or the month after. We're only really concerned about interns that submit more than 3 months later. Okay, so sometimes we might need to advise that they join the next cohort, because it just almost becomes impossible to actually complete at the time that everybody else completes. So they can actually reach out to us for some further advice. This is the framework that we also provided. So if you haven't received this usually is, it's normally sent to you with the Preceptor manual, and it's a really good breakdown, I think. So basically over 9 to 12 months is usually when most of the interns like to complete. We're probably seeing it stretched out more to the 12-month mark these days. But if they're very organised and they submit everything on time as the schedule here, they can basically finish within the first 9 months of commencing. So it can be downloaded also from the important resources tab. And again, if there's any questions about how it's submitted, it's usually just all submitted together via Guild Ed and using the portal. And when it's all submitted, we can obviously queue it then to be marked, and we are marking all year, all day, every day, pretty much. So rest assured that if they are submitting work, it is actually being queued to be marked. So for preceptors, so yourselves, we do actually offer training and support as well for you. So obviously to help with guiding your intern. You will get actually regular communications from the tutors themselves via newsletter, and the mock exam exercises are also usually released and submitted so that you can actually practice with your intern. Obviously on-the-job training is what we sort of suggest to actually get them through the year, but a lot of them like to role play just for their exam. The other thing is we do offer CPD accredited preceptor modules, and I do sort of suggest that if you haven't actually already received access, please reach out to us. You can actually obviously complete that in your own time. And I've actually done the modules myself. It doesn't take too long, and you also get some CPD for it by being a preceptor. So these are the really important key dates for our mid-year cohort. So we have basically the 1st of August, which is when the program commenced. We've got the Pharmacy Connect conference, which starts in a few days, so from tomorrow, and then compulsory work the compulsory workshops that I was talking about. So they are actually being delivered between August and November. So that's workshop 1, so 2 days. And then workshop 2 will be covered as well for anybody who's sitting the February exams. For anybody who decides to separate their exams, there are a lot more interns choosing to separate them now. So perhaps doing written exam in February and then oral exam in June, which is the next time it can be seated. They're welcome to obviously do that, and we can schedule them into another workshop closer to the exam to just offer the support. The February exam period and the June exam periods for next year, so they have not been released yet, but you will actually be notified by a newsletter or email when they are released. So usually they are released within the next few weeks. So September is usually the time that all the exam dates are released so that you can start planning and the intern can plan ahead for their year also. So these are the compulsory workshop details. So like I said, please prompt your intern if they haven't already registered or, put in for leave so that they can actually attend. We do encourage that they all participate, and it is a requirement. And you can actually also sign off 7.5 hours per day, which can count towards their supervised practice. So it does count towards their practice hours. And the only thing is that it doesn't count towards their CPD. So the other, with the online delivery, we do actually require that they're able to have a functioning video camera, and that's basically part of the attendance requirements. So this is just a bit of an overview of workshop 1. So these are the ones that I said will be conducted from August to November, and it's a really good introduction. So basically, if your intern is not very sure about, what they need to do, please reassure them and tell them not to panic. We go through pretty much everything that they need to know for the year within this workshop. Okay, so a lot of it's just giving a bit of an industry update and overview of the intern year. They'll go through some cultural safety examples and content, and then we go through some written oral exam overview just so that they have an idea and a bit of a taster as to what they're going to be assessed. And then there's always an opportunity to do some group work and role plays as well. So workshop 2, this is really heavily concentrated around exam preparations. So it's the 2 days and we split them up. 1 day is focused on the written exam, and then the second day is focused on the oral exam. So basically the 3 areas that we focus on are for the exams are the primary healthcare area, legal and ethical, and also problem solving or clinical. And basically these areas are what are assessed across both exams. So the scenarios that we sort of provide for practice will help to give them, I guess the skills, the knowledge and the competencies in order to actually get through. But I think this is why we require them to attend the workshops. They're compulsory. And if we can't actually see that they have attended, we are unable to sign them off until they have. So the preceptor assessments, this is where you get involved. So basically at the 9-week and 18-week and also the very final assessments, you're required just to tick off some competencies. So basically it's focused around the National Competency Framework, and you need to be able to assess whether the intern is competent in all areas. So this is basically the minimum level that the Australian Pharmacy Council, as well as APRA Pharmacy Board, are requiring in order for an intern to be deemed competent overall. So we get a lot of questions about this, particularly around the compounding of extemporaneous. If you don't do cytotoxic extemporaneous, for instance, and not a lot of pharmacies would, please just assess the intern based on, whether you think they would be comfortable within that setting if they were to be presented with that scenario. And if you feel like it's a no, then I guess, we are expecting that you go through the process, the procedure, and ensure that they do understand. And then that's actually how they are marked off for their competencies. I mean, obviously, if you do, you're able to actually provide them with the actual experience, then please, by all means, we encourage that. So the intern portfolio, this is what I said was the really clunky part of the intern's assessment. It's broken up into 8 components. And then straight off, I suppose, you can see that there are some things that can be done really easily. So their first aid and CPR certificate. A lot of the interns who are vaccinating will obviously be completing this part pretty early on in their internship, particularly if they work in a jurisdiction where the interns can vaccinate. The ITP training plan is basically encouraged to be completed early on in the year. So we have a template that's available for them to download, and we suggest they complete this early on in the year so they can actually plan what they're going to learn for the year ahead. The CPD is an ongoing exercise. So as part of your registration for every pharmacist, you need to complete a CPD plan, and on top of that, CPD record, keep some records of the credits that are attained. So we actually check this at the end when they are all submitted. And then the Pharmacy Board extemporaneous requirements is also one that a lot of them actually get a bit nervous about. So it's submitting 6 differing compounded items and filling out the template for that for each item. And then the second half that you see listed there, so the case-based discussions, the entrustable professional activities, these are fairly new within our intern program, and all of the intern programs are required to actually have these work-based assessment tools incorporated into the programs now. So you may know there's 2 other providers, and the APC, so the Australian Pharmacy Council, that accredit us, they have actually brought in the work-based assessment tools, which I will go through in a little bit more detail. And then you've got things that have been around for a little while now, the reflective activities and the health promotion. If you've been a preceptor with us before, the health promotion's been combined with the oral presentation rubric. So that makes it a little bit easier. And then you've got the final preceptor assessment, which I just went through before. And then the portfolio submission declaration is just to say that the intern has actually done this work themselves. And then you confirm that by just signing off a bit of a checklist. So the work-based assessment tools, or work-based assessments, this is fairly new, and basically it was brought in to provide a little bit more structure to the intern year. And the way I like to see it is it's just formalizing what you're already doing. So if you're providing feedback and you're actually spending time with the intern, giving them some constructive feedback, that sort of thing. But these assessments or these documents are designed to just formalizing what you've actually gone through with them already. So it consists of 3 case-based discussions. The entrustable professional activities are then broken down into 3 separate areas. So there's the dispensing logs, the extemporaneous products, and then the counselling. And then you've got the in-training assessment, which is the reflective activity and the health promotion. So this is just the holistic idea around what the work-based assessments are. It's basically, a collection of activities for them to actually apply into practice, and basically give the learner or the intern, some readiness in their intern journey. It also allows the supervising pharmacist, so yourselves, to track and assess their progress and development of the intern's skills. And, if you need to actually provide feedback to prepare their interns for registration and for unsupervised practice, it's a nice way just to sort of create like a bit more of a structured summary, so that they feel like they've got something to work towards. So I think how the APC likes to look at this in particular is that they want to see some progression with your intern. So they might start off being, not quite ready to actually do certain things. But perhaps within the 3 to 6 months, you start to see that they can do things without being prompted. And then from the 6 to 9 month mark, maybe they can pretty much do things and all you're doing is checking their work, but you'd feel more confident just having them operate independently. So it's a little bit of a shift, and just a little bit of background with the work-based assessments. This was trialled within the universities. So it was actually done as a pilot prior to it being launched into our intern programs. Basically when it was done really well, it actually was really well received, and the intern got a lot out of it, and so did the preceptor. We've actually had some good feedback that it's even helped some preceptors organize their rosters and things so that the interns get a little bit more out of their intern year. So the case-based discussions are basically a retrospective exploration or scenario that by the intern and preceptors. So the intern should choose a case where they're actively involved, and obviously then engage with the scenario and reflect and debrief their thinking and problem-solving skills. And then with the templates that are provided, you can actually mark which stage of your internship it is. And you can't really fail this or be not competent. So the only time you wouldn't be marked as competent is if you just didn't complete the exercise itself. And I guess where you're actually, we're looking just for some growth and some progression throughout their intern year, and giving them the opportunity to look at any gaps, I suppose, within their the year and how they've actually developed, and obviously provide some opportunities to actually learn and further their knowledge. So these are the templates and what they look like. So we've actually got our own template, as you can see, and then you've got the Australian Pharmacy Council. That's basically the documentation, what it looks like. Because we're in the infancy of the work-based assessment tools, we have actually trialled it with our early year cohort, but we're very welcoming of any feedback that comes through from yourselves as well. So the entrustable professional activities. So basically this is looking at the progressive increase in responsibility and autonomy of the intern in carrying out the professional practice activity or task. They must possess certain competencies to complete the task, and over time they should be able to complete the task with minimal supervision. So this is basically what we're aiming for. So the 3 areas that the intern must complete within dispensing, compounding, and counselling. So I think dispensing and counselling within the pharmacy setting, I think that it's probably quite achievable. I know that the compounding exercise has been one that quite a few pharmacies their interns have had a bit of trouble completing it. So our advice for these these interns and the preceptors as well, is all they have to do is create a mock pharmaceutical product. It doesn't need to be one that a patient has actually handed in. We just need to be able to see that they know what is involved in obviously using aseptic technique, and then the techniques required to actually put together an extemporaneous product, storage, labelling, that sort of thing. And according to the Australian Pharmacy Council, they actually see, and the board actually acknowledge that these are the 3 areas that a pharmacist must be competent in, which is why they've actually focused on these areas. So 2 of each of the dispensing products, compounding products, and counselling products need to be submitted at 3 of those milestone times, so the week 9, week 18, and the final intern submission. And if you actually do 2 at each stage, it's just less overwhelming. And the idea is over each of those stages, we should be able to see some progression throughout their year. So along with this, the short practice observations, it's an opportunity for the intern to be observed carrying out one of the EPAs. and basically be provided feedback on their performance and any areas that they need to improve. And this is where we're, I guess, looking for your support. The brief written record should be made following each observation. And what we are suggesting is that the intern actually puts this into writing for you. So we know as preceptors, you're quite busy overall, and we're not asking for you to necessarily give the feedback and document it. You possibly could just give verbal feedback, and then we would suggest that they actually then put that feedback into writing, and all you're doing is signing off the document. And this is what we sort of suggest that the interns do, and work with you to do this. And this is what we're also encouraging the interns to do as well in their workshops. So then the entrustment discussion is basically assessing the readiness of the intern to perform the task with increasing autonomy or, with less supervision. So as you can see, level 1 is basically when, the basic level. And then level 5 is pretty much outside of their intern year, pretty much. So we're probably just looking for level 4, and this doesn't need to be achieved early on. So this year, I suppose we've probably seen a little bit of confusion about this overall. So at the beginning of their internship, if an intern's never worked in a pharmacy, they might just be a level 1, and that does not mean that they're not going to be competent overall, because so long as we see some sort of progression throughout the year at those other milestones, so week 18, final submission, then we are aiming, though, to see the level 4 to be particularly for dispensing and for counselling, because at minimum, I guess this is probably what we would expect. The compounding, I understand that not all the interns will be at a level 4 for compounding necessarily, but we also can't have them at a level 1, or level 2. So I guess, those activities are designed for you to give feedback and also to work with them to ensure that they can at least get to a level 3 or 4. The next section we're talking about is dispensing. So the dispensing logs. So the task for this is to complete 6 dispensing logs for 10 consecutive prescriptions in the chosen categories. So some of the categories are just listed in the green box there, and they need to be able to dispense 10 consecutive scripts without any errors. So these could be critical errors or even near misses. And, the exercise here is basically, to assess whether they can complete dispensing with some good accuracy, because if you don't, obviously, the consequence is that, they could make, a really fatal or, critical error. And then the reality is there would be ramifications for that. So it's just getting them to practice the dispensing, and particularly consecutive dispensing. So this is just what the log looks like and the assessment of the EPA. So as you can see, if you sort of ask the intern just to have a look at this and then familiarise yourself with the template as well, then all it is basically just signing off at the bottom when they have actually achieved this. So the compounding component, so I went through this a little bit before. But part of this is completing an extemporaneous product, which needs to be on the APRA template that we provide, and the supervising pharmacist can conduct the short practice observation while the intern is preparing the compounded product. It doesn't need to be the preceptor, just somebody who can actually supervise. And then after that, the intern needs to complete a reflection, and then the entrustment discussion then follows that reflection. And basically, the idea is, following the whole exercise up to that point, a development plan can actually be organised to address any areas where they need to improve. So the idea is, again, just giving some feedback so that they can actually progress and improve by the time they they complete their next compounding product. And then when they've actually completed all 6 products, then the preceptor needs to complete a statutory declaration, which obviously needs to then be witnessed by another pharmacist, just to say that all the products have been completed. So we're not expecting this stat dec to be done until towards the end of their intern year. So these are the forms. So basically you see they're the pharmacy board form and template that we require. We don't need to see the calculations for the actual products being submitted. So basically all we need to see is, just what they're making. So if it's a cream, we want to know what sort of cream it is, what ingredients are in it. If they want to actually give us the calculations, it's a great exercise, I think. If they want to do it, we do encourage it, but it's not a requirement. We just need to see exactly what they made. And the calculations can be included, but we don't need a lot of detail. So it's just enough so that we know what was made and in what types of quantities. So the short practice observation, you can actually see there's the template for that, and also the assessment of the EPA also follows that as well. So the counselling part, this part is pretty straightforward. So the supervising pharmacist needs to observe the intern counselling a patient or a carer. So the intern might start the consultation and then ask permission of the carer for whether they can be observed, and then basically you provide feedback. And then at the end, you might actually ask the carer to provide feedback as well, or the patient, on the intern's counselling skills. There is actually a feedback form that they can actually provide, and then the end of this scenario, you would then have an entrustment discussion so that of the intern's reflections, and then again create a development plan or some sort of constructive feedback so that they can actually improve on their next counselling experience. So these are the templates. They all look very similar. So I guess you can kind of see there that there's the same sort of pattern. You're looking at short practice observation, providing the intern with the feedback, and then obviously the patient feedback as well, the form that they can actually provide. And then lastly, we sort of go towards the intra-training assessment. This has been traditionally the health promotion, usually really well received on our end. So a lot of the interns might use like a flu clinic or something like that to discuss and learn a little bit more influenza, for instance. They might like to then do an oral presentation within the pharmacy with some staff or with a group of patients to educate them on the same topic. This used to be 2 separate scenarios, but we just combined them just because a lot of the interns were actually doing the presentation based on the health promotion topic anyway. And we just thought, because the majority of them were actually doing this, we thought, it'd be easier to combine the 2 assessments. And then we just need to see some sort of evidence of them achieving these learning objectives. And evidence doesn't need to be anything complex or cumbersome. It can be as simple as taking a photo on their phone, of a display that they've done. It could be a photo of somebody taking a photo of them, maybe like doing the presentation or something. So it just needs to show us that they've actually done the activity. And obviously that would be all that we need for sufficient evidence. And then the reflective learning experiences, the reflective exercises themselves, these are actually broken up also. So I've just gone through the health promotion activity there, but what I probably didn't mention was that there needs to be a minimum of 3 learning objectives or goals. They can't just be and we like them to put a little bit of effort into this. So there needs to be some sort of strategy, how they're going to plan, and it's like setting up an actual health promotion and how you're going to achieve those goals. And sometimes it's a nice little activity for the preceptor to actually challenge the intern with this and set up a promotion that will actually give you some outcomes as well for your business. And then they just need to then present to their target audience and report on that. So the reflective learning experiences, there is a template for them to complete. They can just schedule a discussion time with their supervising pharmacist where you can actually, again, provide the feedback and create a development plan. And then the supervising pharmacist is also required to complete an intern reflective statement assessment and feedback form. So a lot of the time, like I said before, if you don't have time to formally do this, and it is a lot of paper and documentation, please ask your intern to do it on your behalf, and you can just sign off on what you've actually asked them to complete. Okay, so the reflective learning experiences, it's only 4 situations that they need to document and provide throughout their internship. So we split that up again over those 3 milestones. So the 1 at week 9, 1 at week 18, and then 2 will be submitted at their final ITP submission. The intern needs to meet the requirements as a reflector, and confirmed on the intern reflective statement assessment and feedback form for the final 2 reflective activities submitted. So basically, if they follow all of the paperwork and it's all within their intern portal, then they shouldn't miss any of these submissions. Okay, I think that's it. Yep, that's all. So these are our details. So basically, we've got a phone number there, and then we've got our website. Then there's also our email, which is probably the best way to contact the team, because we generally are quite busy running workshops and things. And often if you call and we don't answer, we will get back to you. But at least within the email, wherever we are, we can always respond in between our breaks and things. Okay, so I just want to open up whether there are any questions. I know that it was a lot of information just then. So if you want to, obviously go through anything with your intern and then reach out to us to clarify anything that you're not sure about. But they will be given a lot of the information in their very first workshop. We've had some workshops already scheduled, and there will be some more in the next 3 months. So everybody should have attended workshop 1 by the end of November. And then we have a couple of webinars coming up, which will go through the written exam procedure. So the APC will actually be delivering a webinar this sort of time next Wednesday, which I do encourage the interns to register for. It isn't being recorded, unlike this one. So the intern will have to register and attend. They were actually the APC's wishes. So we encourage everybody to log on. Okay, so I'm just going through to see if there are any questions. So somebody's asked how to access the Preceptor CPD training. So to access the CPD training, please email the team and we can provide you access. I'll actually just click back to that, sorry. So info@internpharmacist.com.au, and we can actually set up right pretty quickly for you. Okay. How do we access the mock exam examples is the next question. Through our Guild Ed or the interns. So the mock exam examples, a lot of them are with the intern. So they need to be able to log into the Guild ITP resources, and there is a section with mock exams. So even if you ask your intern to actually log on and you downloaded them all, and perhaps you could just work with them at a later time, but at least then you could have access. But we have them just housed under their intern portal. Okay. Are there any other questions? Okay, so it doesn't appear to be any other questions. So please reach out to us, and if you think of anything else, particularly now that you've actually been given some more information and insight on the work-based assessment tools, the other place you can go is to the Australian Pharmacy Council's website. They actually have some really good videos, because the team and I actually attended these videos to actually have a better understanding of how the work-based assessment tools work. The other thing is, through the Guild ITP portal, the intern will also have access to this. So they actually have all the videos pretty much embedded within each part of those assessments, and they can also access it so that you can have a look if you decide to do it together, so that you have a better understanding and learn together. But so far, like I said, this has been the first year. If there's anything that you would like us to feed back to the Australian Pharmacy Council about, whether it be the format, the document itself, please, we do welcome it. And just so you know, we've already actually had a meeting with them recently where we were encouraged to give any feedback from our first cohort, so that they could improve the resources. And we're just waiting for the mid-year cohort, so your cohort, to actually provide us with some more feedback. So it is fairly new, and I will say that so far it's been I guess an interesting journey so far, but we are, we feel confident that it's going to actually shape the intern to be and guide them to being a better pharmacist as well. And that it's actually been proven just with the pilot that they actually held at the university level. Okay. All right. So I did schedule this webinar to be an hour, but if there are no more questions, I'm happy to just end the webinar here. And then please feel free to reach out to us, myself or the team, just obviously using any of those platforms that I just mentioned, and we've been more than happy to support you. Okay, so we do wish you all the best. Also, we do really appreciate your efforts. I know that pharmacy's going through some challenges at the time, for the time being, and I think that if you actually do offer your intern some support, and obviously it goes both ways, they need to support you as well, then I think it can be really rewarding, and you'll end up having a really good year ahead. So I think that, obviously if you look after them, they'll look after you, and then there's more longevity. They're more likely to stay. This is my opinion, and within my experience anyway. And for anyone who's been a preceptor before, some of these work-based assessment tools will be very different to former years. So please ensure that you are comfortable and, across everything. Are there any restrictions for the hours for the preceptors working with the interns? I think that what you mean is, how is it restrictions on how long you need to work with the intern? Is that what you mean? So yeah, so I think any restrictions for the hours for the preceptors working with the interns. So I think what you mean is whether Yeah, so for example, 30 hours per week. Okay, so this is a good question. Obviously, in order for you to be able to supervise a lot of the interns' work and those short practice observations, for instance, it would be ideal if you did work with them. Like, I think 30 hours a week would be sufficient. I think if there was any less than that, it would be difficult to observe them. So particularly with the work-based assessment tools, the idea is, you know, like, I guess for the same person to be able to observe, because then there's less ambiguity. So I know that there are some pharmacies where the intern might have a preceptor, but they're not there, you know, like even for 30 hours a week, it might be less than that, which is not really ideal because it'll be really difficult to actually fulfill what they need. And so they are relying on the supervising pharmacists, and the supervising pharmacists, you know, like if they are comfortable assessing the intern and also are comfortable giving the entrustment discussions and assessments, the APC have actually said that this would be acceptable. I mean, it's better than nothing, but the idea is for the same person as best as possible. So I know, for instance, if the preceptor goes on holidays and they're away for a few weeks throughout the intern year, that's not possible. So then in that case, then a supervising pharmacist might sign off. But where it actually says preceptor needs to sign off, even if the supervising pharmacist signs up until a particular point, the entrustment discussions, for instance, the preceptor needs to sign off on. So they're looking for consistency is probably what the aim is. But I think 30 hours would be ideal. Yep. You're welcome. You're welcome. The other thing is, if if the intern happens to, your situation changes and you happen to change your roster for whatever reason, we do suggest that the intern reaches out to AHPRA to have their approved preceptor changed. I know it's a little bit painful, as in the time it can take to have all the documentation turned around and, you know, changed, but it's better, you're better off in the long run, and for you and for them, because it's less pressure on you and also for them to follow you up so you can sign off on their paperwork. And I know that, you know, within the last few years, particularly with COVID around, this has happened a lot and more. So if those situations change, the other thing is we do suggest that the interns have their supervised practice hours signed off weekly, I think, at most. So if they're not actually giving you their supervised practice form to sign off on, please, again, prompt them. Like, we encourage them as best we can, but I know sometimes, you know, they have exams and other things on their mind, and I know it's something else for you to follow them up on. But even if it's just a check-in, you know, weekly, fortnightly, it's also then less work for you in the end. Like, I know that I probably wouldn't be very happy signing off 6 weeks worth of signatures and, you know, in one hit. I think I'd rather do them weekly or fortnightly. But obviously have that discussion. I think as well, you know, like, they can then just be reassured as well that they're up to date with where they're at and that their hours that they're working are being recognised also. The other thing I wanted to mention is with the supervised practice hours, if the intern is in regular attendance at your pharmacy, they are, you know, entitled to actually having their hours signed off. They don't need to be attending and at a level of competency. So I know that there has been some confusion in the past where some preceptors won't sign off on their supervised practice forms because they also, you know, don't think they're perhaps, you know, ready to actually do certain tasks yet. But we're just looking at their attendance, their regular attendance to their rostered shift, for instance. And then what I encourage as well is, if you have an intern, you know, like, obviously to assist them with their primary healthcare scenario for their exam, particularly the oral exam, ask, you know, I would challenge you to allow them to champion the S3 counter so that, you know, if somebody comes in, you know, perhaps not straight up, but maybe when they're halfway through the internship or a quarter of the way, have the patients ask, if the patient's asked, you know, for the pharmacist to actually have a look at something like a rash, their eye, or anything like that, just encourage your intern to actually have a look at those scenarios. I know that I encourage the interns to do that, just so that they actually get practice at looking at different ailments and conditions, and just developing that confidence as well to ask questions with your guidance, of course. Okay. All right. So again, I'm just looking at the time. If there's no more questions, I think I will just leave it there. Okay. Good night, everyone, and thank you so much for your time tonight.